Hello all, I'm Dr. Priyanka, gastroenterologist. Today I'm going to talk about blood in stools. What are the important causes and when we should seek medical attention? So first and foremost, I will tell you blood can be like a fresh blood or it can present with black stools. So if anybody is passing black stools, please don't ignore. It's an old blood which is there in intestines and has come as black stools. So if you are passing dark, tarry, black stools, it's a sign of gastrointestinal bleeding. So there are various causes. So if blood is coming like drops, it can be because of constipation induced cut at the anal region. We call it as fissures. It can be because of piles, that is hemorrhoids. It can be because of polyps in the large intestines. And sometimes blood in stool happens because of colon cancers also. So please be careful. If you are having blood in stools, timely examination is very important. And then if we find there is no cut and fissures, there is no history of constipation, we do endoscopies, that is we do colonoscopy, the endoscopy of the large intestine, and we see sometimes very significant diseases like colon cancers. Sometimes we find ulcers in the intestines, sometimes it is polyps, and some of the polyps are precancerous also. So endoscopy is very important. If you are having loose stools with blood, sometimes it's in case of inflammatory bowel disease like ulcerative colitis, and in that case also endoscopy is very important because there will be characteristic features of large ulcers with oozing blood in the intestines, and there will be a lot of edema. If anybody is having blood in stools, endoscopy is very important investigation if we have ruled out fissures. And never ignore blood in stools, because if we have ignored early cancers which is easily operable and curable, might turn into a metastatic disease, a severe disease where treatment is not possible or you have crossed the stage of treatment. So never ignore blood in stools. And what else we do? So if anybody is having blood in stools, and sometimes if you are not observing it, there may be anemia. So low hemoglobin is one of the important markers. If there is no significant bleeding from any other site in the body and you are having anemia, and then please watch your stools whether it is black or sometimes you are passing blood in stools. And then there are other associated symptoms also. If there is an abdominal pain with blood, then there are many diseases that present with both, like inflammatory bowel disease can present with severe abdominal pain, diarrhea, and blood in stools. And then if you are having if you are more than 55 year of age and there is loss of weight and appetite, and there is low hemoglobin, and you are passing blood in stools, probably there may be chances of cancer also. Then another important cause of sometimes trauma. Because of trauma also there may be bleeding, and in some of the cases any cancer patients who are receiving radiations, so after radiations there are small blood vessels which regenerate and sometimes oozes out. So in that case we do some endoscopic therapies to coagulate those blood vessels so that patient can be comfortable without bleeding. So because of chronic constipation and digital evacuation, we find solitary rectal ulcers. So there will be an isolated single ulcers in the colon, and that may be the cause of bleeding. And if it's in profuse bleeding, if the blood is coming in clots, it may be life threatening. Patient can go into shock, and there may be severe loss of hemoglobin. So always seek an urgent medical attention if you're passing blood like clots, or if there is a profuse bleeding from the anus. And through endoscopies, various therapies we do. If there is a profuse bleeding, we try to put some clip to stop the bleeding. Sometimes we use some sprays, or sometimes it's APC. And we try to diagnose the disease first, that what's happening and where from the blood coming. And if we don't find the cause, then we do CT scans. And if it is from the small intestines, so sometimes through endoscopies we are not able to see the whole intestines. So from upper GI endoscopy we can see till the initial part of proximal part of intestines, and through lower GI endoscopies we can just see the terminal part of small intestine. So major part of small intestines cannot be seen by endoscopies. So for that we sometimes do, if we are not finding any clue and any cause of blood in stools, then we do capsule endoscopy also. So in capsule endoscopy we ask the patient to take that capsule in, and that in the capsule there is a camera attached, and the whole recording happens. And through the sensors we collect the recording inside the stomach and in the intestines, and then it comes out through the stool. And after recording through the sensors, we attach that device to the software, and we can read entire intestine through capsule endoscopy, which is mostly a non-invasive test. Patient just have to swallow that capsule and that's it. And sometimes even in blood and stools we need to do an upper GI endoscopies. So it may be a case of chronic liver disease, where a lot of dilated blood vessels are there in the intestines because of chronic liver disease, and these blood vessels gets ruptured, and there is a lot of blood in vomiting, or it may come as a black stool, and if it's very fast then it may come as a fresh GI bleeding. So upper GI endoscopy is also important. Sometimes patient who are on NSAIDs, who are on painkillers, they are taking a lot of painkillers to reduce their pain for arthritis, or if they are taking ecospirins or medications for heart disease, they may suffer from gastritis. And sometimes because of lot of acidity they may develop duodenal ulcers, and in case of duodenal ulcers there may be severe profuse bleed, and which may become a life threatening situation. So we have to give urgent blood transfusions, and we have to urgently treat them by endotherapy. So this was my talk about blood in stools and GI bleeding. I hope you would have liked it, and be aware, ask your families and relatives if somebody is having, because if they are passing blood in stools, sometimes especially females, they are very shy, they try to hide, they don't want to speak about it, and once it is very severe then we come to know, and that at that time it's already very late. So we should be on time for early diagnosis and proper treatment, so that we can prevent complication and we can save the life. Thank you so much.